Can I get rid of these lines under my eyes? I'm 16 and I don't know what they are. Can I get rid of them? If so, how? Please, need some help.
Thank you for your question. You're 16 years old, you've submitted a photo, and you're asking about lines under your eyes and how to get rid of them. Well, I will guide you a little bit with this question, and hopefully it'll help you understand what your situation is. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, oculoplastic reconstructive surgeon. This means that my training foundation was first in eye surgery before I pursued advanced specialty training in complex reconstructive and cosmetic surgeries of the eyelids. And I've been in practice for over 20 years in Manhattan and Long Island. So at 16, you are asking about lines under your eyes. And I can probably just simplify this for you in that the lines under your eyes are just normal lines, and that a lot of times people come in with concerns about lines and hollowing. And for people who have more age-related changes, and we'll distinguish this from genetics, but age-related changes, we routinely use something like Restylane or Juvederm or something like in the hyaluronic acid family, combined with platelet-rich plasma to help improve skin quality. But you notice I stated that this was for age-related changes. At 16, you're young. Your face is still in development. Your facial bone structure is still developing. The soft tissue in your face and everything else will be changing. So I would state that with the minimal amount of care, which is basically good, maybe a moisturizer, not a super expensive under eye cream or anything like that, but a typical moisturizer, sunblock, and proper nutrition and hydration, I think you will be able to at least manage it as best as you can, but don't expect that you won't have any lines around the eyes. It is normal to have lines around the eyes, and it is normal to have a certain shape. And so, a lot of times people come in who have genetic hollowing, which it's very clear that and they're young, so it's not an age-related change. Now there are exceptions. We will take care of patients who are in their 20s or mid to late 20s who have these genetic issues, but the reason why I'll treat them is that their facial growth and evolving changes to an adult facial structure has already plateaued. So it's kind of not a moving target. And of course, we want to be practical and do things when the time is right. As an aside, I can tell you that our youngest patient we ever did under eye bag surgery was 14 years old. But that was a genetic situation where the child had puffiness that resulted in significant bulges under the eyes that made everyone think that he was on drugs. And so it was a very important issue for him. I can tell you what I tell a lot of my patients is when people look at you, they look at the big picture. They don't look at the little details. We ourselves as individuals, we look at ourselves in detail and believe sometimes that everyone else is seeing that particular detail, when the reality is most people are looking at the big picture. So again, I would defer any type of intervention for many years, and I would say that just take care of your skin, use a little common sense and a little guidance from your family, and I think that you would probably be better off not doing anything at this time. So I hope that was helpful. I wish you the best of luck. Thank you for your question.